Good evening, good afternoon, or good morning, everybody, wherever you may be in this world. We are here today to speak about Bell's palsy, and we are broadcasting from Crystal Touch Bell's Palsy Clinic here in Rotterdam, the Netherlands. A few words about our clinic. Crystal Touch, as far as I know, is the only clinic that is specialized exclusively on residuals and complications of Bell's palsy in particular, but also on other kinds of peripheral facial palsy. It can be also post-traumatic, surgery-related, herpes virus-related, and other tumors and so on. We work with patients who have residuals and complications after Bell's palsy, which has been caused by all that I have just mentioned. We have developed a special method that helps us to compose rehabilitation programs for our patients. I myself and also our other specialist, Elena Pashova, we are the members of World Federation of Neurorehabilitation, and our method that we have developed have been presented during the World Congress for Neurorehabilitation in Istanbul in 2014. There are two major types of facial palsies that exist. It's either central palsy or peripheral palsy. Central palsy is simply said what happens with our face when we have a temporal ischemic attack or a stroke, is simply said. Then, as you can see here, when the central palsy takes place, then only the lower part of the face becomes affected, and the patient can still close his or her eye, and he lose only the control over the lower part of the face, because the nerve, the cranial nerve number 7, which is facial nerve, is not affected in any way. It still retains its ability to conduct the signals if those signals are coming from the brain. The situation with the lower motor neuron lesion or facial palsy, peripheral facial palsy related to facial nerve damage itself involves the whole half of the face most of the time. In the absolute majority of cases, only one side, one half of the face is involved, and the other part of the face, half of the face, remains active. So we are very well familiar with this situation, unfortunately. And as you know then better than anyone else, the facial palsy, Bell's palsy, has a dramatic effect on the quality of life. Apart of the fact that person loses the ability to express emotions, with one half of the face, self-esteem suffers, social contact suffer, try to stay inside, limit their interactions with others, and it's really have very big emotional impact, and you have this experience firsthand. Let's talk a little bit about the physiology of our brain and nerve system. We all know from school or from our further education that our body is managed by electrical signals. And electrical signals or impulses are generated in the brain, and from the brain, which is a control tower, it goes to the whole body, controlling various functions of our glands, of our tissue, of our muscles, of our blood vessels. Everything you can imagine in our body is managed by electrical signals arriving from the brain. And for us, in the course of this webinar, we will be talking particularly about only one sort of nerve cells, which is called motor neuron. And here on the left, in the left part of this slide, you can see a motor neuron connected to two other neurons, and it has three major parts. First part is cell body, which is called soma. The other part is dendrites or dendrites. These are they look like branches of the tree. That's why they're called dendrites, because dendros in Greek is a tree. It has also a long wire, which is called axon, and through that wire, the nerve cell sends signals to either other neurons or to the muscles. And the place where the nerve wire axon ends and the other one, either neuron or muscle, takes over the signal is called a synapse. To give you an idea about how powerful our brain is in terms of electric capacity, they say that if there was a way to connect our brain to the small bulb inside your fridge, which gives light, then our brain is so powerful that it will be able to give light to that bulb, to give light to your fridge, so to say, during the whole 24 hours non-stop. So we have here quite a powerful instrument which participates and actually manages all activities in our body. Let's take a closer look about the structure of muscle and its innervation. It's important to understand what is how the whole system works. Muscle consists of various strands and bundles of muscle fibers, but at the end of the day, it is the muscle fiber, single muscle fiber here, for example, or the other one, which contracts together or separately from other muscle fibers, which produces muscle contraction, and then in our case, we can produce facial expressions. When the nerve, this is the axon, which is insulated by a protein which is called myelin. I will talk about it a little bit later in more detail. When axon reaches the muscle fibers, it splits itself to terminals. These small branch-like pieces, they call terminals, which simultaneously deliver signals to several muscle fibers. To give you a comparison, the muscle in our leg is, because it's doing fairly simple job, either contraction or relaxation, flexion or relaxation. One nerve cell, this wire, one nerve cell, neuron, provides terminals from a couple of hundred to a couple of thousand muscle fibers, because management is fairly simple. Either you contract or you relax. But in the case with the facial muscles, it's totally different story, because our facial muscles must be able to contract or relax single fibers, which allows us to produce the whole rich palette of facial expressions. If it were only contract or relax the whole muscle, then our mimetic movements, facial movements, would be very poor, and our face would not be able to serve the purpose as a communication tool. And of course, as we have learned so far in our lives, the most powerful communication tool that has existed so far is our face. Just one smile or one look can tell us more than many words. Okay, let's take a closer look at the construction of the nerve fiber, which is nerve cell, neuron, and then later on we'll have a look at the nerve structure. I'm telling you so much of the theory and anatomy, so you have a very good understanding how the whole thing is constructed, how it works, and why facial palsy happens, and why it does not recover overnight or over day, and why medications that we take do not have immediate effect, and very often the recovery of the mimetic movements, we have to wait for it for several weeks, or even in some cases for 2 or 3 months before first movements return. So let's take a closer look at our neuron. Neuron, as I said, consists of soma, the body, which contains nucleus, of course, dendrites. All these branch-like formations exist just for one purpose: to receive signals from other neurons. Then we have axon. This is the wire that connects the nerve cell, neuron in our case, motor neuron is called, because we are talking about the neurons which provide signals for muscle management, muscle contraction and relaxation. And that wire has electric insulation, which you can see here as necklace looking buds, which are, by the way, also living cells. They're called Schwann cells. So each of those necklace pieces, it's a living cell which wraps itself around the axon to provide electrical insulation. Why it is important? Because, of course, as any electric wire, if it is not insulated, the currents will leak, and the wire will not be able to serve its purpose, which is to conduct electric signals from the source to the target. Also, these synapses or neuromuscular junctions, as they are called, it is when the neuron splits and connects to various muscle fibers, and that's where the signal from neuron goes over to the muscles. That's important part. By the way, of course, many of you have heard, well, I think everybody has heard about Botox injections, which in some cases help with the reducing of symptoms of complications like synkinesis, contractures, and so on. The injections of Botox, which is essentially a neurotoxin, poison, so to say, they are blocking transmission of signals from nerve to the muscle here at neuromuscular junctions at synapses, and that block is irreversible. So in order to recover its function, and our body is not stupid, and if something is damaged, the body wants to recover the function, to regenerate and be able to work in a normal way. So the neuron start to grow side branches, or terminals, they're called side terminals, which after some time will reconnect to the same muscle fiber as the damaged ones. That's why the effect of botulinum toxin lasts from 2 to 5 months, depending on how much time your nerve, which has been blocked from its transmitting the signals, needs to recover, in sense to regenerate and to grow that side terminal to reconnect it to its muscle. That's how it how the neuron structure. Let's talk about the structure of the nerve here. We can compare any nerve, especially the motor nerve, as a thick telephone cable, which contains bundles that go from the telephone station to various neighborhoods, and then they split to go to some apartment blocks, and then they split again to go to particular apartment, and then split again to go to every single telephone set in the house. That's how it works. So as you can see here, the construction is very similar. There are also a couple of blood vessels. One is small artery, which is called arteriola. Other one is a small vein, which is called venula. And these two are very, very important for the normal functioning of facial nerve. Why? Because obviously through the artery, our nerve, which is a living thing, receives water, nutrients, oxygen, most important, and through the vein or venula, small painted blue, CO2 is evacuated, then metabolic products are evacuated, and all the side products which may poison the cell or the tissue for that matter are removed, and the organ, and in this case facial nerve, can maintain its normal functioning. Everybody knows that we can live without food 30, 40 days, without water a week, maybe 10 days, but without oxygen, already after 10 minutes, our brain sustains such a damage which makes essentially return to normal life impossible. So the nerve cells are extremely sensitive to a lack of oxygen. That is one of the reasons why it is very, very important when facial palsy happens. We are talking now, for example, about Bell's palsy. It is very important to remove the damaging factor from the site as soon as possible, because the nerve gets compressed, the blood vessels become compressed, oxygen supply is interrupted, and all kinds of pathologic processes start taking place. And that's why we need to remove the damaging factor as soon as possible to minimize the damage. And if you don't do that, then the recovery may take much, much, much longer time. That is the reason I'm looking a little bit forward, but okay. That is the reason why in most cases, if you have a facial palsy, your doctor will prescribe you prednisone, because prednisone is considered to be a medication that promotes evacuation of liquid water, which reduces in its turn swelling of the tissue that is surrounding the facial nerve and compresses it, so we have what is called conduction block. Let's continue with our anatomic excursion and take a closer look at the structure of the nerve and also at some facial muscles. As you can see, this is the facial nerve. When facial nerve leaves our skull and surfaces just below just next to the earlobe here, from our skull to the surface of the face, it branches into almost in every direction on our face, including the scalp. By the way, the fact that our nerve is also branching to the scalp, why it is necessary for the nerve to go there? Because scalp is also covered with a very thin layer of muscles, and those muscles also receive their nerve signals, their managing signals from the facial nerve. That's why when incomplete recovery has taken place, many patients have issues with headaches on the affected side, also face pains here in the neck. Here, it's all because the recovery of the facial nerve, because it took a long time, and there are some irregularities occurred that have a consequence, facial pains and pains also on the affected side of the head here. We'll talk about those pains a little later during today's presentation. Facial muscles. Actually, here we have two muscles which do not belong to facial muscles because they don't receive their signals from facial nerve, but from the trigeminal nerve. It's temporal muscle, this one, and masseter muscle, this one. These are two muscles of mastication, and they do not belong to the facial nerve area of responsibility, so to say, but they are on the face, so we have put them here so you have a more harmonious, more balanced picture about our facial muscles. Just a few words about them. Frontal muscles lifts the eyebrow. These three muscles, frown muscle or procerus muscle, it pulls eyebrows together and down. These two pulls them together. The circular muscle of the eye have two parts. One is using for squinting your eye, and the other one is used to close your eyelid and to lift up the lower eyelid, so it participates in the act of blinking. Then you have nasal muscle, which makes rimples on your nose. The muscle which lifts the upper lip. Two zygomatic muscles, very important for forming of the smile. The minor and the major muscles, I call them the smile group. And most of the time when people say, okay, I have a crooked smile, I don't like the word crooked, but it's asymmetric smile. It's mostly because these muscles are not always doing their job properly, especially if the recovery after Bell's palsy, or facial palsy for that matter, took a long time. We have also risorius muscle, is the muscle that makes small dimples here in the chin. It's called smile muscle, literally. Not in every person that muscle is active. In some of us it is. Then that's why I have those small dimples here, which by many considered as a very cute feature on the face. I like them too. Then we have a circular muscle of the mouth, which makes us be able to pucker our lips, to kiss, to drink from the straw, and so on. Then we have a muscle which pulls down the mouth corner. It's called depressor anguli oris, and actually this muscle is very often standing in the way to our smile because due to the long recovery period in the brain, there has been formed a certain mimetic pattern that instead of when we smile, instead of involving only zygomatic muscles and relaxing the depressor anguli oris, which is actually an antagonist of zygomatic muscles, it engages them both. So actually our mouth corner is being pulled in both directions, as a result of which it stays where it is, or even sometimes being pulled downwards, because the muscle that pulls down the mouth corner, as you can see, it's very big, thick, and strong. And mentalis muscle, this one, it lifts up the chin and also participates in some negative emotions, or emotions of negative emotions, so to say, disbelief, disgust, fear, anger, and so on. And that's also one of the reasons why here on this chin muscle sometimes we have dimples, because together with the depressor anguli oris, this muscle becomes involved in either spontaneously or in the act of smiling. That's why from antagonism of these two pairs of muscles, some of facial palsy sufferers, especially long timers, have dimples here in the chin. Let's talk a little bit about how the damage to facial nerve happens. In the normal state, as you can see here on the left, everything is normal. Cell body is normal. The wire axon is normal. The myelin sheath is working properly, and all the signals are reaching their targets, which is in our case facial muscles, without any interruptions or irregularities. When facial palsy happens, for one or the other reason, the nerve becomes compressed. It can be many reasons. It could be vascular reasons, which means that certain a sudden spasm of certain vessels, blood vessels, disrupts the flow of oxygen, leads to local swelling of the tissue and nerve compression. This it has not been proved yet, but I think that that can be one of the reasons why in many cases women who are pregnant on the last weeks of their pregnancy develop facial palsy. Another reason could be infection. For instance, if otitis media, the inflammation of parotid gland, the gland that produces the saliva, can compress the nerve. And also, of course, otitis media is the inflammation of the inner ear, also can produce inflammation which will spread and also affect the facial nerve, and it will compress it. Also, herpes virus, which has a special name, Ramsay-Hunt syndrome. If the herpes virus eruption takes place around this area where the facial nerve is running into quite long and curved narrow channel, the eruption of herpes virus blisters, of course, also compresses the nerve. That is the reason why when the doctor suspects that there is a herpes virus, could be the cause of the palsy, he will prescribe you antiviral medications just to suppress the virus and again to remove the damaging factor as soon as possible. Now, if we have not removed, in this case, in this situation, the nerve still functions. It functions not 100%. That's why just before developing the facial palsy, the patient may experience some uneasy feeling, some weird sensation on the taste buds of the tongue, sometimes painful sensations, but the nerve is still functioning. But at a certain moment, from the compression, those cells, which are, as I said before, live cells, Schwann cells, they die, because in a compressed condition, they cannot survive for long. They die. And if the myelin sheath electrical insulation is gone, then the nerve cannot function anymore. So it stops conducting the signals and develops a conduction block. When conduction block has developed, which means that the nerve fibers, or then the axons of all or most of the nerve cells in the facial nerve, have lost their myelin sheath, and they're not able to provide conduction of the signals. If in this state it is still possible to achieve relatively quick recovery from 1.5 to 5 weeks to full spontaneous recovery, so you close that page and forget it. And that's, again, I cannot emphasize it often enough, that it is very important to take measures to remove the damaging factor from the site of damage as soon as possible, because at this stage the axon, the wire that conducts actually the electrical signals, it is still alive, it is still functioning. but it does not take long. If the damaging factor has not been removed from the site of damage within 3-4 days, then disconnection takes place, and that is already physical disconnection between the facial nerve nucleus, which is located inside the brain, so it's not damaged. Again, I repeat, when facial palsy happens, Bell's palsy, the root, so to say, of the nerve is not damaged. So the nerve does not die. What dies is what's called distal part of the axon, which means the part between the site of damage, which is most of the time, 99% is here, in the pyramid of temporal bone, and the facial muscles. That part of the axon disconnects and then degenerates. And after degeneration has taken place, the immune system activates its resources and clears up all debris from dead axon, from dead Schwann cells, and so the regeneration can start taking place. We have to realize very clearly, as soon as any damage in our body happens, our body immediately starts reparative measures. So as soon as the damage to the nerve fiber has happened, in this case axon, motor neuron, axon of the motor neuron, immediately the regeneration starts to take place. We'll talk about that in a very short while. And if the disconnection has taken place, like here on this picture, then the regeneration process takes quite a long time. Why? Because according to scientific research, the regeneration speed of a nerve fiber is, in the very best circumstances, under very best condition, it is not more than 1 millimeter per day, in the best possible case scenario. Which means that if, for example, in my case, I have quite a large head, so the distance from here, where I could have the Bell's palsy, facial palsy, distance to my facial muscles is about 9 to 10 centimeters, and that is 90 to 100 millimeters. If you count 1 millimeter per day, we quickly arrive at the figure of 90 days, which is about 3 months. That is why, especially in heavy cases, and Ramsay-Hunt syndrome, herpes virus, is considered, between others, as a pretty heavy case, the recovery makes us wait for it. I mean visible signs of recovery. It does happen as from day one, but visible signs of recovery make us wait for it from 1.5 to 3, sometimes longer, to 3 months, and sometimes longer. That is why it is very important. Okay, in your case, it is already late because you have already been through this experience. But if you meet anyone else or want to share your experience and knowledge with someone else, please, who has still an acute phase of facial palsy, please explain that the recovery will come. The regeneration is on the way. It is going on as we speak. And whatever happens, with a very few exceptions, I'll talk about them in a minute, the recovery will come. The muscles will start moving again. So there should be no space for despair and no space for losing hope. It is very important. You know that better than anyone else. The most damaging is the absence of hope and despair. Will it remain like this until the end of my days? No. The only exception to what I just said is when the nerve trunk, the body of the nerve, has been physically severed, when it has been torn or cut. It can be due to the trauma, when the temporal bone is broken. Sometimes the nerve gets simply torn, cut in two physically separated pieces. Then it will not regenerate by itself. A special operation is necessary. Lucky for us, the science and the surgery science medicine, surgical medicine, has advanced very much in the recent decades, and it is possible to sew these two pieces together to achieve at least certain amount of recovery of facial movements. Or, for example, sometimes, most often due to the tumor, when the tumor develops and is wrapped around facial nerve, then it is very often impossible to preserve the nerve while removing the tumor. Sometimes it is possible, and surgeons do their absolute best to do so because they know very well what impact it will have on the individual. But sometimes it is not possible, and the surgeon is forced to cut the nerve to remove the tumor. In this case, there are other techniques available to recover, at least to a certain degree, facial movements. It is hardly possible to restore facial movements after this kind of damage to 100%, but there are some surgical techniques that provide for that, but those techniques are not the topic of our today's meeting, so we'll not discuss them in detail.